It probably actually started 6 years ago, and I was unaware, that they were symptoms of Lyme because I didn't know that I had Lyme yet. I was running my own business, and so my first issues were physical, like my knees. Hot flashes, I had temperature fluctuations, chills, kind of low-grade fevers. I had been seeing a lot of different doctors, but my main symptom was I actually lost 14 inches of my long thoracic nerve. So my shoulder blades, instead of moving like this and sliding when I moved my arms, they would actually pull away from my body. That was excruciating. All the doctors I was seeing and all the specialists, they were just trying to prescribe me, gabapentin and things to just dull the nerve feelings, and that terrified me because I'm like, no, there's a reason why. So like the knees, that turned into getting MRIs and the doctor saying, well, you can try physical therapy, but you're gonna have to just have surgery on both your knees. And I was like, I'm not having surgery at 35 years old. And then it got to where I was on so many medications that if a new symptom arose, I couldn't differentiate, where that was coming from. Is this a side effect from one of these 7 medications? I kept going back to my primary care because she started noticing my disorganized thinking, I guess, and my anxiety and my frustrations and aggression maybe a little bit too with just what was going on and what I couldn't figure out. And she was finally like, she's like, we should test you for Lyme. And she called me on the phone and she said, your Lyme panel came back positive. A little bit of relief that there's finally something, because every panel, every test, everything was just like, everything looks good. I had Bartonella, Babesia, Ehrlichia, Anaplasma. My mycotoxin load, my mold load was through the roof. I think where my fear came from was when I did a little research and they talked about nerve die-off. And I thought, oh man, I'm in the last stage of Lyme. I was like, I knew that I had to do something drastic to get help to change my life. I had narrowed it down to 3 places. Envita was my top one. I watched, a lot of their videos and I saw just the facility in here and how it looks. They wanted it to be a very comfortable, just like in your home, they have all these comfy recliners and couches. Once I communicated with Envita, once I made contact and started communicating with Samantha, it was like a no-brainer. I just felt it. When I first saw her in person, she was like, we kind of became best friends via email. I was like, I know. We just back and forth. She helped me with everything. They already knew what a typical Lyme patient's frustrations already are, especially if you've, had it for a certain amount of time. Dr. Warren, he is the only doctor in this entire experience of years and years of seeing all these specialists and all these doctors that listens, that hears what you're saying. He knows that we know our bodies and that we know what we've been feeling, and what we're sharing with him is the most important part of him setting up a treatment. The very first thing I noticed about the nurses and the staff here was that they were so loving and caring and sweet, and not even just to the patients, but to each other. It was probably week 5 that then things started to really change for the better, getting better every day. And then it was week 6 that my brain started to gain these moments of clarity. This is what it's like for my brain to work how it should. And that happened back and forth, the brain switch. And that's when I knew something amazingly dramatic was happening in my brain. And then at the end of week 6, there's been no more reverting back. Most all of my symptoms that I had are gone. And so I do think that Envita, really saved my life.